Welcome back to another episode of Age to Perfection, where we explore all things beauty, wellness, and healthy aging. Today, we're shining a spotlight on a topic that affects so many people, but isn't talked about enough: melasma. Are you curious about those pesky dark patches that show up on your skin, seemingly uninvited? We're here to break it all down for you. From what causes melasma to the latest treatments and prevention tips, we're cutting through the confusion with expert insight, practical advice, and a whole lot of encouragement.
Hi everybody. We are back and welcome to Aged to Perfection with Dr. Uzz Patel. Today we are drinking Nebbiolo from Italy, from the Piedmont region. And the reason I chose this wine for this podcast is because today we are talking about the dreaded M word, melasma. And so to give you a little insight on my crazy, which you know I'm already crazy. So we were in Italy, we're on the boat in the Amalfi Coast. And of course, I'm under I'm the only person under the shaded area of the boat, like hiding under my hat, my SPF and everything. And then I go home that night at the hotel room and I'm like, do I have it? Do I have it? Is it there? do it show up? So I thought we could visit my, anytime sun exposure, anytime heat, we always fear the melasma, right? Yeah. So I thought today, let's kind of dive into melasma. Let's discuss on what causes it, how we can treat it, and what kind of the secrets behind it. Maybe the things that we don't find on Google, right? So how many times a week do you have this conversation? On average, which we're a skewed demographic, guys, because we are in Houston, Texas.
Yeah. So we're in a melting pot. We're in the heat, right? All the time, pretty much year round. I would say probably on average, I talk about melasma with my patients about 2 to 3 times a day.
I was going to say 2 times a week. That's less. 2 to 3 times a day, I believe it.
Yeah, definitely.
So normally, how does that conversation go? They come in and they say what?
I mean, they want a cure, right? And then I have to break it down to them that unfortunately there's no cure. So, they want to get rid of it. Everybody wants flawless skin. The first thing they want to do, I don't want to wear makeup. I just don't want to have to wear makeup anymore. I don't want to have to try to cover it up. What can we do so that I don't have to wear makeup, right? That's everybody's goal. And I don't blame them.
Everybody's goal.
I don't blame anybody.
You know what I've realized? A lot of my patients don't even know what melasma is. They'll come in and they'll say, see this brown spot? Yeah, I was in the sun and it's there. Can you just laser it off or can we just peel it off? And I'm like,
doesn't
okay, it's not a sun damage. That's not a freckle. That's melasma. So when you talk to, let's say if you're telling your daughter, Lily, right? Yeah. Like, how would you tell her to look for that melasma? How is it different than that sunspot or that age spot?
Well, I mean, like you said, there's a lot of different reasons that it pops up, right? But I usually tell my patients that skin pigmentation is actually difficult to diagnose. So sometimes melasma also, isn't melasma, even though we think it is. So, you usually have those brown patches around the upper lip, the forehead, under the cheek or around the cheek. Those are probably the most common areas. And so when I see it there, that's not really just a spot, or it's more of a kind of feel like spot paint,
I tell my patients, it's like, imagine your 3-year-old took some bronzer and decided to give you makeup.
Yes. And so, I tell them, I go, this could be melasma. Most of the time it is, but sometimes it's not. There's so many different dermopathologies that can happen with pigmentation, and we need to get down to the bottom of it. But it is a struggle. It is definitely a struggle. And I feel for them because I have melasma. And it is hard. I mean, I love to go on beach vacations and I love to be outside with the kids and I take the dog for walks. And, it's really hard to be out of the sun in Texas, right? Because that's our weather. So, yeah.
Well, so let's talk about the dermatopathology and the physiology of melasma, right? We talked about some of the triggers. Yes. So the fact that we're in the heat.
Yes.
And I think a lot of times people have to realize it's not just the sun, it's the heat. And people can't differentiate between that. So I tell my patients, like, if you have melasma, no more hot yoga for you.
Right.
No more saunas.
Right.
No more hot tubs. You have to, it's not just about staying out of the sun. It's about keeping your skin cool.
Right.
And then the other part of it is the hormones.
Right.
Right. I think that's something a lot of people don't talk about. So when people say, hey, I have melasma and I can cure it, I want my patients to understand that the cure part is usually if you get melasma during a pregnancy.
Right.
Or if it's triggered by a medication, right? Certain antibiotics, certain birth controls can actually trigger melasma, which birth control is a trigger for melasma, guys.
Yes.
Like, don't forget that. And so if these are things that you're going to get exposed to. Always kind of keep that in the back of your mind. So drug-induced and pregnancy-induced melasma, I feel like if you treat it and you get on top of it, that can go away.
It can, but I feel like it always reoccurs. It's like waking the beast up. I always tell everybody, I'm like, there's a beast once you have melasma, and it's like taming the beast versus waking it up. And even with birth control, which I took when I was younger, I don't know if that's what caused it. I probably got it more after pregnancy. Again, hormonal, right?
Did it go away after and then come back?
Not really.
Okay.
Well, no, actually, you know what? Yes, it did. It went away and then it kind of came back in I say older years, but it was kind of my mid-30s. Like, I was done being pregnant at 30 and then it kind of flared up at like 35, 36 as I started to age. And I had it in pregnancy. It kind of went away and then it came back. And now it's just here to stay. Like, it's just, if I go on a vacation, like we were in the Caymans this summer, I came back. You even said it. You're like, what's happening to your face?
I was like, did you forget your Darth Vader mask?
Yes.
Which, by the way, she has a Darth Vader mask that literally looks like
And
Darth
I don't
Vader.
even care anymore. I wear it to soccer games. I wear it. I told one of my patients today who has melasma. She's out in the sun with soccer and she's like, I have to laser now. And I'm like, I know, and it's going to make it better. But you need to wear something more. She's like, I have an umbrella and a baseball hat. I'm like, I'm sorry, it's not cutting it. So I gave her the link.
Yeah.
I don't mind looking crazy. I mean, most people nowadays think it's because of COVID, but it's not. It's to
not.
save my face. It's literally called Save My Face UV Shield. That's what it is, because it's saving your face.
There you go.
Oh.
So speaking of melasma and how it starts. So for our patients' purposes, we're not talking to our fellow clinicians. Their average mom, when she's looking at melasma, I want our patients to understand these are melanocytes.
Right.
These are the cells that make pigmentation. These are temperamental cells.
Yes.
Any little thing that irritates these cells will make them produce pigmentation, especially in skin type 4, 5, and 6.
Right.
4, 5, and 6 is your Asians, your African Americans, and your Latinas, your Hispanics. So if you have a little bit of that brown, even though you're light-skinned, you are prone to have melasma.
Yeah.
The other big part of it is not just the sun exposure and all of that genetics. One of the biggest reasons I'm scared of it is that my mom has it. All 6 of her sisters have it.
Right.
It's coming for me. I know it's coming. I know it's coming for me.
You made it this far. I think you might be in the
So let's talk about treatments then.
Yeah.
We're all going to Google. We're all going to learn about the mueslis. We're all going to learn about the acids and the hydroquinone.
Right.
Tell me about your experience.
Which is controversial, right? There's some trains of thoughts where they don't want to use hydroquinone, and then there's the other half of us that absolutely love our hydroquinone. I'm in the practice that I love my hydroquinone for my patients, for myself. Now, I do holidays, right, for treatments. If we're talking about topicals right now, then for topical treatments, I do recommend anti-inflammatory type products like the niacinamides. I do like tranexamic acid, and I cycle on and off of those for my patients and myself with the hydroquinone, but I'm a believer in hydroquinone. I'm just going to lay it out there.
What's too high? Is there a limit that you go? Do you keep it under?
Not really. I mean, average.
Do you go more 6%, 8%?
8% is pretty average for me on a daily basis, even for my patients. I think once we get to the point where they're happy, then I'll kind of taper them off to maybe a 4% a day and then switch them off to TXA. But if it flares again, then I kind of go back to the hydroquinone. And also seasonally, right? We talk about seasonal skincare a lot. So, October to April or May, those 6 months, typically I'll put my patients on hydroquinone. And then when summer hits, then I kind of change them over to like a tranexamic acid.
Niacinamide, all of that.
Kind of a
so for those of you who are not aware of these acids and what they are, yes, you can go out there and read about it. But at the end of the day, they all paralyze the melanocyte in a different way. Right? All the mechanism of actions are different. The reason that hydroquinone is still kind of what we call the king is because hydroquinone on a cellular level paralyzes that melanocyte better than all of these other acids, if I had to put it in layman's terms.
Yeah.
Now, the reason hydroquinone gets a bad reputation is because, yes, just like everything else, too much of anything good ends up being bad. So yes, hydroquinone does thin the skin. Yes, hydroquinone does make you sensitive to the sun. Yes, hydroquinone too long of a use can cause
onchronosis, which really is a very low percentage. I mean, the risk factor of that, I see it more when patients are getting a little too aggressive with their hydroquinone, meaning they're not just using it on their face. Now they're just like, oh, let me just take it down to my neck and chest. So it's a lot of counseling. You need to be under a doctor's care that knows how to prescribe and how to counsel you on hydroquinone usage. those things just happen when you get a little carried away. That's really what ends up.
All of the complications I have seen with hydroquinone in my patients has been because they have not been advised properly on when to start it,
Right.
when to stop it, when to take the breaks. And then, of course, like all human nature, we get greedy.
Yeah.
I'm greedy.
So more is better.
More is better. However, we are now learning that more is not better. Right? So while I tell my patients, stay out of the sun, stay out of the heat, get off of your birth control, I think let's talk about treatment options.
Yeah.
Okay.
So what can you do in the office?
In the office, give me my 5.
Oh my gosh, she's pop quizzing me right now, putting me on the spot. Okay, well, there's chemical peels, right? There are lasers.
Specifically your Pico and Laser
your
Genesis.
Pico laser, your Laser Genesis. And they both do 2 different things that we can kind of get into further, maybe in a later podcast. I feel like melasma could go on forever.
We could do a 2-hour special episode.
Yeah,
honestly.
Exactly. Let's see, what else do we do? For microneedling is another option.
I always throw in PRP with my microneedling for my melasma patients. I honestly feel like the growth factors from the PRP really, and here's why. Because we know that in melasma, you are having all of these tyrosinase inhibitors, and what they're doing is they're breaking down that type 4 collagen.
Right.
So if you notice the skin in the melasma layer itself, that skin will be a little bit thinner. Then the top membrane will be a little bit thinner than the rest of that surrounding skin. So you're really breaking down the type 4 collagen on a microscopic level. So I feel like when I add the PRP in, it really helps give me that skin health and that skin thickness back into it. And I think a lot of practitioners are so hyper-focused on the pigmentary issues with melasma that they're not focusing on the skin health in general, right?
Right.
Because everything we're throwing at melasma, hydroquinone is thinning the skin. All these acids are thinning the skin. So yes, while we're doing some good, we're also doing some damage.
Right.
And I feel like you do have to kind of approach it in that full sense, right?
Yeah, definitely.
So there's your microneedling PRP. And then, one thing that I feel like is very underrated is actually HRT.
Yep. I always forget about hormone replacement.
Everybody does.
But it is important because especially this is hormonal. So a lot of times when you're going through menopause or perimenopause, you might have already had a little bit of underlying, but then it really flares and you're just wondering why. It also goes back to skin health because when you start to lose that balance, your skin becomes unhealthy and pigmentation starts to show up. So yeah, I agree.
Now, I want you guys to know that HRT is a very balanced thing because it can also cause melasma to flare up. So just be careful where you're doing it. Because I like to explain to my patients that it's not just the low levels of hormones. It's the up and down tanking, and up and tank, up and tank, up and tank.
Right.
That happens in pregnancy too. That's why melasma shows up. That happens in menopause, which is why melasma shows up. But I think for most of our patients, Jamie has done such a good job of making sure that roller coaster just stays steady. That is actually majority of our patients have seen an improvement in your melasma. I feel like since she started medicating you, I feel like your melasma's gotten
definitely better.
A lot better.
It takes a lot of work, but it's better for sure. It's tamed.
I know. So you just went to Lisbon for an international conference.
Yeah.
What'd you learn? What is our colleagues that are not in Houston doing? Because melasma is more prevalent in the Asian countries.
It is. And interestingly enough, what I walked away from is there isn't anything amazing that anybody has discovered. Now, there are a couple of things that I think have not become too popular, but we're starting to see it a little bit more, like oral tranexamic acid, right?
Me and you have been doing that for a while, but nobody else in our industry
is really doing it, and I think it's a great adjunct. I use it more for my patients that are resistant or we've tried some of these treatments that we've already talked about before I go to that oral jump, and it has to be pretty severe. You have to have it diagnosed as melasma, right? And that does help a lot. That's one of the things that we talked about. We also talked about microneedling, which I feel like is underutilized.
It is underutilized.
And I think that's a great one for it. And then remember, there's this component of vascularity that we forget. So like what people don't understand is that even though melasma is brown and these cells are brown and they're melanocytes that we're talking about, they're fed by a blood supply. And so that's why we like laser genesis a lot, or even vascular treatments to kind of not heat up the skin because that's bad for melasma, but to decrease the blood supply that's creating an aggravation to these beast cells. I always call them, we're just trying to tame the beast. Those cells are just hyperactive. How do we get them to die off or become less active? So,
which is actually where all the new
combination-
research is right now. So if you look across the board, the newest research studies that are happening are actually not even, we're all going away from treating the melanocyte as a cell itself.
Right.
And we're trying to see, is it the mast cells? Is it, where can we cut off that supply? That drive. Yeah. So that the beast doesn't wake up in the first place.
Exactly.
Right? So why wait for that trigger?
Mm-hmm.
Which kind of brings me to my next thought process. And I feel like as an industry, me and you take a different approach because we have that family medicine background. And so we are very much prevention. Why wait for it to show up, right? Which is why I'm the crazy person in a hotel room in Rome looking for my melasma patches. And so I tell all of my patients I think the biggest message that you're not going to find on Google, the biggest message that you're not going to find online or on Instagram or anything like that is prevention. So if my 20-year-olds are telling me, hey, Dr. Patel, I think I want to get pregnant, guess what?
Yeah.
I'm going to make sure you have your vitamin C. I'm going to make sure we can't do retinol. So let's do something with a little skin cell turnover that you can get. If we're not going to control the hormones, let's make sure if it's a summer pregnancy, I educate you and I, guide you on how to keep all of those things at bay. And then, believe it or not, for especially my pregnant patients, PRP microneedling, I told them, I was like, your blood is at your richest when you're pregnant. That baby's sucking the life out of you. You take advantage of that. And so we do a lot of that PRP microneedling. And I honestly feel like it's the prevention. I think if we're catching our patients early that have the genetic predisposition for it, that have the risk, your soccer moms, your baseball moms. Now, but by the way, now you're a baseball mom.
I am. Baseball, soccer, tennis. My children have decided to do outdoor sports indefinitely.
So that really limits your...
Remember I have a last?
I know, but that really limits your... So I had this conversation today. My patient, she was very much like, I have boys. I live outside.
Yeah.
I tell me what I can do, but I can't do anything photosensitive.
But one of the keys is also reapplying your sunscreen, which most people don't do. They wear it, they go out with it, but they don't reapply it, right? So you want to keep that as part of your routine when you're an outdoor soccer mom, baseball mom. Reapply it every couple of hours, stay out of the sun as much as possible. And then I have one of those fans, because remember we talked about it's heat activated too. So the more you can cool down your skin and your internal body temperature, the less active your melanocytes are going to be at that time. It's a lot of work to go watch a baseball game.
It is a lot of work. Okay. Your established melasma patients, give me your January through December. Like what are our treatment plans? What are we doing? Like I know every patient is different.
Yeah, they are.
But me and you both have our after so many years of doing this, we have our little cheat sheet and our guideline.
So typically what I do initially is I put them on a cosmeceutical, some sort of topical, right? Like we talked about hydroquinone or tranexamic. You cannot do treatments without having the post-care and the pre-care and all of the care in between that you're having to do at home, right? Sunscreen, all of that. So that's primary. Then it's your treatment. So I alternate. I do a little bit of Genesis, a little bit of Pico, a little bit of microneedle. And then I tell my patients, what did you see the most results from? What was your melasma the most reactive to? And then we do a little bit more of that with a little bit of the other stuff. So let's say it's microneedling, then we might do 6 microneedles in a year with PRP and do a couple of Genesis treatments in between that, right? And I customize it based on how the skin reacts, because for some people, their melasma reacts really well to a Pico. Great. Well, we're going to do that a little bit more. Or it reacts to the Genesis, which means they have a lot more of that blood supply that's feeding it.
And less of the heat.
Yeah, so we're doing that a little bit more. I probably tend to use less chemical peels than you do. For melasma.
My drugs.
I think I just have a little bit of a fear sometimes, just with darker skin types and what can happen. I've seen a lot of laser burns.
I've seen actually chemical burns.
Chemical burns, sorry.
One of my patients, he came in because he got regular hydroquinone as a product, but he was started on 8%.
Yeah.
And while he is our ethnicity, he's a little bit darker. So I would still put him as a skin type 6.
Yeah.
He ended up burning.
Yeah.
On hydroquinone 8%. So this is where you really need to know who's managing.
Yeah, and how much.
Because these are serious acids. These are not, like you said, 13, 14 years of doing this, and you're still a little scared of them.
I'm still a little scared of the chemical peels. I mean, I do
As you
layer
should
them
be.
in.
As
I
you
layer
should
them
be.
in if we need to. But, those are probably, I feel a little safer with my energy-based devices, and my microneedling is kind of a safe bet. But yeah, that's sort of my protocol. And then I just let them know this is a lifelong relationship. We're just taming the beast. If things look better for a while, that's great. We're winning. And if things start to flare up, it's just the nature of what melasma is like. And you just come see me a little bit more often. A lot of times you find out that they've been to the beach, which is why it's flared, or they forgot their sunscreen and sat out in the sun, or they stopped using some of their products they're supposed to be using at home. Either they ran out, or they just decided it was just too much work, or it wasn't working.
I think the hardest message I've had to get across to my melasma patients is that this is a lifelong relationship.
Mm-hmm.
Like I'm not gonna get you looking better. And this happens time and again. They look great. They look better. Wonderful. Then they'll disappear for a year and a half, and they'll come back. I'm like, oh my God, what happened?
Worse, and it's worse.
And it's worse. I'm like,
and it takes that much longer to get it to go away then.
Yes. So
yeah,
if you're going to take the time to have the conversation, if you're going to take the time to learn about it, and you really, really want to do something, I think it's really important to know that this is a lifelong journey.
Yeah.
You do not get to just stop it in the middle. It doesn't work like that. And then I think the other part, our monthly membership was based solely on a lot of our melasma patients, just because they needed so much of that hand-holding.
They needed to come in every month.
Mm-hmm.
Yeah.
And I follow pretty much the same protocol that you do as far as figuring out what works for my patients. The only thing, and I know you do this too, but I'm going to mention it because you didn't, is I always tell my patients, if you're going to go on vacation, if you're going for the weekend to Florida or Mexico or anywhere, 2 weeks later, you need to be in my office.
Yeah.
Because you need to do that pico. Even if you don't see that flare up, even if the melasma isn't there, you're not going to see it until 2 months from then.
Yeah.
It doesn't come on like it. Sometimes it is that gradual.
Yeah.
And so don't forget those preventive
measures. Yeah, for sure.
Right.
I mean, there's things that you can do proactively if you know you're going to be in the heat and sun exposure. You just have to do it.
Okay. Give me my melasma skincare. Oh, if you have melasma, what should you have in your skincare?
Well, you know me. I like my hydroquinone like we talked about. So
No. Start at the beginning.
Start at the beginning. Okay, so a gentle cleanser, because we're not trying to aggravate anything. So I do like gentle cleanser for my melasma patients.
You don't do your heavy acids for that?
I don't. I use the skin polish, sometimes like a resurface polish. There's a few that I like.
But like just once or twice a week?
Yeah. So I do that 2 or 3 times a week when I'm in the shower. I have the Zeo one. I have the Elastin one. Anything that has a little bit of glycolic and salicylic. But I only do that a couple of times a week because I'm already using, once I do my cleanser, I'm already using glycolic and I'm already using salicylic in my products for that skin turnover in the morning. And then I use a hydroquinone and use a little bit of vitamin C. I use the C Radical Defense because I'm a little sensitive to vitamin C. So I use that one for Melastin. And then I literally lather myself in sunscreen. Like that is basically my CC cream or whatever you guys want to call it. But zinc titanium based SPF 35.
That's important. Zinc titanium.
It's all physical, not chemical.
Yes.
Right. Because I don't want to irritate. And then at night, I kind of do a repeat of the routine. The only thing I change up is I'm using more of my tretinoin or retinol. And I only do that 2 or 3 times a week because my skin is really sensitive, but I still use a hydroquinone. I use my moisturizer. I still use a little bit of, that's my cell turnover.
And you're very sensitive. So what, you have to do a little bit thicker when you're on your acids, right?
I use a little bit more moisturizer just because now I'm getting older, so my skin is drying out too. So I just lather on the moisturizer. But I use my cell turnover products in the morning and night every day. The only difference is my cleanser is gentle so that I'm not irritating my face more. And then every couple of days, I'll do the skin polish or something. So it's been working well. But I also do my microneedling. I also do a pico every now and then. I also do laser genesis. I think for me, microneedling has worked the best.
It
so
is. That's
I love it.
That's,
so that's
your
kind
magic.
of my magic, and that's been helping me a lot. I haven't done chemical peels because my skin is sensitive.
Your skin's too sensitive. I won't touch you with
So that's kind of my cosmeceutical routine, and I try to stick to it. I do know that when I get off of it or when I get lazy, let's just say, where I'm just tired and I'm like, okay, I'm not doing it tonight. If I go even a week or 2 like that, it comes back, and then that's my motivation because then I can see it on my skin. So I've just got to keep up with it is what I realized.
Yeah. So take home. Definitely an antioxidant, definitely a physical sunscreen, definitely in the wintertime, hydroquinone, summertime, more of your plant-based.
Tranexamic
acid, all of,
most
and
of
your
the
little
TXAs
retinol.
have niacinamide in it. So
Yes, they do. As a complementary.
Yeah. So I think skincare, honestly, with melasma is probably the top priority.
It is.
And then after that, it's the treatment supplement, and that helps a lot.
Yeah. And then I would say if you're on this skincare anti-aging journey, then like I said, if you're planning pregnancies, if you're around the menopause age, just have that active conversation.
There's modifications that can help you along the way with every situation, for sure.
Anything else about melasma? I think we covered it all.
I think we brushed the surface probably. We covered a good amount. It's like you could probably have a whole nother conversation about the lasers and laser energy and what's safe and what's not. I think that would be a great podcast for our viewers because
we can do a specific laser one.
Well, yeah, because I feel like melasma is one of those things where people will go and say, hey, you should do an IPL or you should do a Fraxel or you should do this to get the pigment. And we need to get a little bit deeper into educating. What won't you do on your
melasma patients? Is there anything that you don't? You're like, you have melasma, I will not touch you.
I don't want to heat it, right? So I'm not doing a CO2 on them, right?
How do you feel like IPL?
I'm not going to do an IPL on them.
Thank you. I have so many patients that come in and be like, oh yeah, they did an IPL. I'm like, why? Why did somebody touch you with an IPL?
That's heat and it's surface, and I think it aggravates it more.
I agree.
I think we could literally get into a whole nother conversation on what you should not do if you have melasma, right? Outside of the heat, but treatments, because I think those are one of the things that people want to know.
Yes.
They go to different places and they don't always know, no, I shouldn't be doing that because I do have melasma.
Yeah. So anything that's going to heat your skin, you need to stay away from.
So I'd say stay tuned for part 2 of what you don't do.
Then stay tuned for part 2 on what you don't do for melasma.
Before we wrap up today's episode, we want to take a moment to thank our amazing listeners for tuning in and joining us on this melasma deep dive. Don't forget to subscribe so you never miss an episode. If you've been loving Age to Perfection, you won't want to miss our next episode. We're talking all things hair, from thinning and care routines to styling tips. And we'll have a special guest. Renowned hairstylist Manny G is joining us. Whether you're looking to revamp your hair or simply want expert advice, we have you covered. Stay tuned.